So hello, my name is Tia Pruett. We're going to be going through Medicare 101. Here is my wonderful family. You'll see my husband, Sean, in the white shirt. He's another Medicare agent. My son, Nehemiah, he's actually, he's a bassoonist and he is a little engineer. He's the kid that just is the one that makes my garage really messy, actually. My middle daughter there, Naomi, she is my little brainiac. Right now she's doing some dance and she's going to be playing the oboe this year. So we're kind of excited for that. And then my youngest daughter, Nava, she is my little soccer player. She is just the sweetest thing under the sun and my little ray of sunshine. I love her. So you'll see my name up here, Tia Pruett. So I am a licensed insurance broker. So I specialize in Medicare. I've been doing this for over 4 years. This is all I do. It's truly my niche. And so other insurances, you know, this is it. This is all I do. So if you'd like, you can write down my phone number. This is where you can reach me. So my number is 737-747-0026. So you can also email me or go and schedule an appointment through the website, hansonfirst.com. So the greatest thing, I'm going to start by telling you the greatest thing about having an agent is one, it doesn't cost anything for my help. If you, whatever type of plan you want, I can get that for you, whether it's a no premium plan, it stays a no premium. If it's a plan that has a premium, just know it would be the same cost as if you just went online and did it yourself. So, and I'm here to guide you, to help give you tips, to tell you about the newest news on what's happening in the industry and the changes to Medicare. And really, once I'm the one who helps you get enrolled, I stay your agent as long as I'm the one who enrolls you. And I continue to be the person that you can contact rather than sitting on the phone for 3 hours waiting for customer service to answer your question. So it's really kind of a great way to get customer service and get your needs met quickly and make the right decision the first time. So just to make it all quick, we'll just start with what is Medicare. So the basics really, it's a federal health insurance program. It's only for U.S. citizens and legal residents. It's actually been funded by your taxes and by even people who are younger than you by their taxes while they've been working and while you were working. So Medicare is not a family health insurance program. It is individual. So it's not free because remember, you've been paying for it with your taxes. And you're going to find out when we get later on in this in this workshop, you're going to find out that there are some costs to Medicare. So it's not family health. It's actually not Social Security, although that's where you're going to apply for your Medicare if you need to apply for it. Medicare is the health insurance piece. Social Security is the financial piece. So they're two separate things. You don't have to apply for them at the same time, although you can if you'd like. And then this last bullet, Medicaid. Medicaid is the help for low-income individuals. So Medicare is health insurance. Medicaid is assistance for low-income individuals. All right. So like I said before, the people who can get it are people who are U.S. citizens or legal residents. If you're a legal resident, you just have to live in the United States for at least 5 years, and it has to be the 5 years leading up to when you became eligible for Medicare. So most people who can get Medicare are 65 and older, although if you have some sort of qualifying disability, on your 25th month of disability, you will automatically be enrolled in Medicare, and a card will just be sent to you. And if you have some of these specific diagnoses like an end-stage renal disease or ALS, those also automatically qualify you for Medicare. I don't know why they picked those two, but hey, great for you if that's what you got. All right, so you might be wondering, your first question is, when do I enroll? How does this all start? Like at what age, when? Well, it's all surrounds the initial enrollment period surrounds your birthday, your 65th birthday. So it is the 3 months before your birthday, the month of your birthday, and 3 months after. That's when you can enroll and apply for Medicare. Now, for some people, they're just automatically enrolled, and you might be wondering, well, why? They're automatically enrolled because they're already receiving Social Security benefits. If that's the case, you don't have to go to ssa.gov and apply. A card will just be sent to you in the mail. Now, it has to be, you make sure that your address is your correct address in your Social Security account. Now, if you have to actively apply for Medicare because you're not taking Social Security, then you'll want to go to ssa.gov, create an account online, and then inside there, once it's 3 months before your birthday month, you'll see a clickable button, and you just click on that button to apply for Medicare A and B. So after you've applied, then that's where I come in. Once you have that Medicare A and B, I will help you sift through all these options that you have after getting you're applying for Medicare and getting your Medicare number. Now, I always recommend that you apply early, because ideally your Medicare would start on your 65th birthday month. It's actually the first day of your 65th birthday month. Even if you were born, let's say it was May 31st was your birthday. Well, your Medicare starts May 1st. So you get that extra 30 days or whatever. So kind of nice. All right. So next, you might be wondering, well, what happens if I don't get Medicare? What happens if I don't apply, or I forgot to apply during that time, or I was just not in the headspace to apply? Well, you might have some late enrollment penalties. Now, if you're eligible for premium-free Medicare Part A, well, then you don't have to worry about a penalty. Most people are eligible for premium-free Part A, and I'll talk about that in a later slide. But if you're not, then there is a 10% penalty on that Part A premium if you don't apply when you're first eligible. Medicare Part B. Now that, as long as you have a special enrollment period, we're going to talk about that when it comes to like employer coverage, then and you have other credible coverage, well, then you might be able to delay Part B and you can just get on it without a penalty. But if you turn 65 and you don't have credible coverage, then this penalty of 10% of the monthly Part B premium amount for every 12-month period is added to that monthly premium. So that can get pretty expensive pretty quickly. So if you don't know about credible coverage, this next slide is going to help you. So the third piece is another possible penalty you could get is Medicare Part D, which is for your drugs. If you go without creditable drug coverage for more than 63 days, then you will have a penalty. And the penalty is 1% of the average Part D premium for every month you did not enroll. So you were eligible but didn't enroll in a drug plan. So that's why I always tell people, just get any form of a drug plan, whether that's a standalone plan or a Medicare Advantage plan with drugs. Just get something so that you don't have to worry about that penalty. Okay. Hey, so anybody working past 65? There are a few questions you will want to ask your employer, human resources, benefits coordinator, retiree, whoever handles that, the HR department. These are the questions you will want to ask. Number one, will I be able to stay on my employer insurance now that I'm 65? 2, if I can, will I need to enroll in original Medicare Part B without a penalty? That's the important piece, because your employer may say, oh yeah, you can enroll in Part B if you want. Well, but if you don't, will there be a penalty? That's the key. We want to find that out. Number 3, will my insurance benefits be changing? And if so, you want to request something called a summary of benefits. And what that does is that kind of outlines what your coverage looks like, how much it's going to cost for hospitalization, how much it's going to cost for a specialist visit. Will you have a deductible? What is your maximum out of pocket? Those types of things. And then lastly, will my prescription drug coverage remain the same? And remember this, you might want to take a picture of this actually, or you can also take a screenshot. Will it be credible prescription drug coverage according to Medicare? That is key. And you may be wondering, well, how do I figure this out? So oftentimes when a person turns 65, I believe by law, they're required to tell you or give you a sheet of paper that said this coverage is creditable according to Medicare. You also may have coverage through your spouse. You want to reach out to your spouse's employer to find out what your coverage will look like once you're 65. And if you can delay enrollment in Part B, or if you need to get it at that time, they will be the ones who can answer those questions. All right. So bottom of the, most important thing to know is that Medicare and your employer insurance can work together. It just depends on what your employer will require of you, whether that means you have to get Part B or not, and whether you're credible, your drug coverage is credible or not. If you take any part of Medicare, you will no longer be able to contribute to an HSA. Just be aware of that because your contributions will impact your taxes. If you have questions about that, you'll want to reach out to your accountant to find out what types of potential tax penalties you might experience if you have continued to contribute to your HSA. And then lastly, you just got to think about other people in your family if you're the one who's been carrying their insurance. So, because Medicare, once you get on Medicare, it only covers you. So many employer plans, once the primary employee is no longer working, well, then the spouse and the dependents won't be covered under that plan. So just make sure you consider those options when you think about leaving your employer coverage and going on to a Medicare plan. And I can help you navigate that. That's something I do all day, every day with everyone. So, so feel free to reach out and call me, text me, email me, however you want to reach me, because I walk people through this all the time. So I'm very used to fielding these kinds of questions. All right. So what's original Medicare? In a nutshell, this is the most basic slide you're going to see on here. Part A is your hospital coverage and inpatient care. On average, so there is the cost with those is Part A does have a deductible. This year it's a little over $1,600. That only pays for like your hospital bed and some of these other Part A benefits I'm going to talk about. And then it goes into a per day copay after 60 days. So, and then there's even higher costs. So Part A can get pretty pricey if you have a long hospital stay. Then Part B, that helps pay for your doctor and outpatient care. It's pretty much all your other doctoring. So Part B has a couple of costs associated with it. So one, there is a Part B annual deductible of $240. And then in addition to that, you're responsible for 20% of every service that you ever have that falls under Part B. So that can get really expensive really quickly. For example, there was a client in my agency. She went to the hospital with an unknown heart condition. She was there for 90 days. When she got out, the bill was $400,000 and she owed over $30,000 under original Medicare because all she had was this red, white, and blue card that was just Part A and Part B. She didn't have any other coverage on top of it. There was nothing to cap her costs because original Medicare, it has no ceiling when it comes to that 20% adding up and adding up and adding up. And that's why I tell people, no matter what you pick anything just to give yourself that cap. So just that's just a little hint at what some of those little costs can look like if you just have original Medicare. And that's kind of why I do what I do, because my whole purpose is to help people make sure they have the coverage they need when they need it, that fits their budget and their health needs. So let's get into Part A, a little bit more detail. So Part A, your hospital insurance, this is what Part A covers. So it's a pretty long list. You have the room, meals, special units, intensive care, any drugs given while you're there in the hospital setting as an inpatient, x-rays, medical equipment, if they have to operate on you, operating room and recovery services, skilled nursing, hospice care, part-time skilled care, and then rehab services. So some good important things to know is that Part A typically doesn't have a premium. As long as you've worked 10 years or 40 quarters, or your spouse has, then you don't have to worry about paying a premium for that. You can't be denied coverage if you're eligible. It's nationwide. any doctor that accepts Medicare will accept Part A. And then coverage and costs, it is based on that benefit period. So I did talk about, the 60 days. And then once you're past that 60 days, then there's a 90-day period. And then there's, you'll see there's 60 lifetime reserve days that you have if you're in there for a really long time. So you do have to be admitted as an inpatient. It's not you can't be an observation status because that falls under Part B. So Part B. Okay. Speaking of, this is most of your doctoring, your doctor visits. So every time you see a specialist, that falls under Part B. Even if you're in the hospital, every specialist that visits you, that's a Part B benefit. Your wellness visits, your labs, so that's all your blood work, urine tests, MRIs, CT scans, different screenings and programs, physical therapy, durable medical equipment like your CPAPs, your oxygen. So ambulatory surgical centers, so like your surgeries, like cataract surgery, those types of things fall under Part B. So you can kind of see how that's most of your doctoring. So as far as some important information to know about Part B does have a premium. A couple of things to know about that. The average monthly premium this year is $174.70 a month. Now that's for 2024. It's going up in 2025. Those numbers haven't been released yet. Another important piece to know is that this monthly premium is based on your modified adjusted gross income as reported on your IRS taxes from 2 years ago. So if your income 2 years ago was over $103,000 as a single individual, well, then that $174.70, you're going to pay more than that. And if you're a married couple, then if you make over $206,000 annually, then you're also going to be charged more. Now, if you have questions about that, just come and see me, talk to me afterwards, and I can tell you kind of, there's a chart that shows all the categories. They break your income into brackets. So it's pretty simple. And I can tell you kind of what you can expect to pay monthly for your Part B premium. You can't be denied coverage. It's nationwide. Anyone who accepts Medicare takes Part B. You do have a penalty for late enrollment. So again, just like we talked about those penalties, you don't want to not enroll when you're first eligible if you don't have any other credible coverage. So the special enrollment period, that would be if you have credible coverage and you can delay your Part B because your work coverage or your retiree coverage allows you to do so. All right. Well, Medicare covers a lot of things, but it doesn't cover everything. So you're still going to have costs, just like I told you about those deductibles and those percentages. You're still going to have to pay something for your coverage. It also, surprisingly, doesn't cover drugs. That's why we have other plans to give you prescription drug coverage. For some odd reason, Medicare also doesn't cover dental, vision, or hearing. I don't know why your teeth and your eyeballs and your ears are not really considered medical, but Medicare doesn't cover that. So that's why people, again, they get like an add-on plan of some sort, which we'll talk about. No eyeglasses, contacts, or hearing aids are covered. That long-term care or custodial care, those are separate. You'd have to get a separate policy if you wanted those types of, if you wanted that benefit. Doesn't cover excess charges. And if you're outside of the US, Medicare's a stateside domestic program. So it's designed to be used here in the United States. All right. So once you get your Medicare A and B, you really only have two pathways. You can't mix the two. It's either one or the other. So if you take the first path, let's say you do this light blue path, option one, it's kind of the a la carte method. You're piecing together your coverage. So in this option that you choose, you get a Part D, which is a drug plan, and which has its own premium. And then you get a Medigap or Medicare supplement plan, and that helps pay some of the costs for your Part A and B, whatever those different costs are. This will help pay for that. And that also has its own premium. So the other option, and again, you can't mix that. The other option you can choose is a Medicare Advantage plan, also called Part C. I don't know why Medicare always has two names for everything. They have a letter and they have a number and they have a name. They just mix it all up. But anyway, so Medicare Advantage Part C plan. What this does is this is through private insurance companies. Again, just like the other ones I talked about. And this is like kind of like an employer plan. It's an all-in-one plan. It includes all the benefits of Part A and Part B, and usually drug Part D, your drug prescriptions, all into one plan. Oftentimes these ones also include dental, vision, and hearing coverage, all in one plan. So some people like that because when they go to the doctor, they go to the dentist, they go to the pharmacy, it's just one card they show to everyone. So a lot of people like that option. Okay, Part C, some more details. Kind of, I already said a little bit of this, but Medicare Advantage plans, they are required by law to cover all the benefits of Part A, all the benefits of Part B. That's why people used to call them Medicare replacement plans. They don't replace Medicare. You still have to keep your Medicare and continue to pay that Part B premium, and whatever premiums you have for Part A, if you had a premium for Part A. But it has all those benefits that it covers: Part A, Part B, usually prescription drugs, and then, like I said, dental exams, eye exams, because those are not covered by original Medicare. So these are these extra bonus ancillary features that they offer: hearing tests, hearing aids, eyeglasses, cleanings, and a gym membership. Yay! So usually, those the gym memberships are usually at no cost to the members. So that's kind of nice. And other important pieces to note: Medicare Advantage plans, they operate differently than Medicare. You know how Medicare doesn't really have a network. You can just see any doctor that accepts Medicare. Well, Advantage plans operate like employer coverage, and in that way they have networks typically. So they have HMOs, and PPOs are the most popular plans around here, where an HMO, you can kind of think of it like a circle. An HMO, you have to stay inside that circle, in that network. So you have to see doctors in the network, and they act like a gatekeeper. They're the ones that give a referral to a specialist who's also inside of that network. Now, if you go out of the network, you're 100% on your own. You pay 100% of the cost. You have no coverage if you go out of the network. Now, a PPO still has that network, but what's nice is two things. One, you don't have to get a referral to a specialist. You just go straight to a specialist. And two, you don't have to stay inside that network. You can go out of the network if you'd like. You're going to pay less money if you stay in the network. So if you stay in the network, well, then that's the cheapest, but you can just pay a little bit more and go outside of the network. And the other great thing is if you pick a PPO that has a national network, well, that's great for people who travel or have family in other states. I always like it because you can go, like if you're visiting family in California, or if you have a specialist that, let's say you moved here from Colorado and if you have a specialist there, it's great to be able to go back to that state and possibly pay just the in-network copay because they might be in the network in that other state because it's a national network. So, and even if they're not in the network, well, you'll just pay the higher out-of-network copay and still have coverage. So that's kind of a nice benefit. Other types of plans, they do have special needs plans. So there's dual special needs. That's for someone who has Medicare and Medicaid for low-income individuals. And what it does is it takes those two benefits, it combines them into one plan called a dual plan, like a 2-in-1. And then in addition, that dual plan usually gives much richer benefits than if you were to just have those two benefits on your own. So usually it has extra dental, sometimes extra food benefits, just some really nice benefits in those dual plans. Also, we have chronic special needs plans in this area. I like those because if you have any sort of qualifying chronic health condition, then you can sometimes get cheaper prescriptions. You can get some extra benefits that are built into this plan and designed for people with chronic conditions. Some of the most popular chronic qualifying conditions would be things like diabetes, COPD, chronic heart failure. Those type of conditions usually qualify a person for a CSNP plan or a chronic special needs plan. Other types of plans that are offered are private fee-for-service, MSA plans, so there's just an ISNPs. All right, so other fast facts about Advantage plans. You have to have Medicare A and B, and you have to live in the service area. So Medicare Advantage plans are county specific. So I have people all the time that they've moved from, another state, and they came here and I helped them get enrolled in a plan that was offered in this county. I mean, it doesn't have to be out of state. It can also be someone who moved from Bexar County up here to Williamson County or Travis County. So just from county to county, because they're plan county specific, you can enroll in a new plan based in your new area. So, but it has to be offered in your area. Another thing is you can't be denied coverage. These plans are great. They have to take you no matter what. So whatever pre-existing health conditions, you can be about to die in the hospital and you sign your signature on a plan and they have to take you no matter what. So that's kind of nice. Also, you might be required to use provider and pharmacy networks. That's a typical thing, just probably like employer plans that you've had before where they had networks. Coverage and costs, they do vary based on the plan you choose. So your copays are plan specific. You can get in HMO plans, like those have some really low copays and some really rich ancillary benefits. Some PPO plans, those ones have a little higher copays because you have that freedom to go out of the network. But still, a lot of them have some really rich benefits still. And those benefits, they can change every year. Every year you'll get something in the mail called an annual notice of change document, also called an ANOC. That document tells you any changes that have happened to your plan, whether that's any changes to the drugs that are covered, to any copays, any ancillary benefit changes. So it's kind of nice. You're still going to get that information just shared with you no matter, what changes come your way. So they always have a maximum out of pocket, which is an annual limit on how much your copays you can spend for coverage services. Some of them have monthly premiums, a lot of them don't. So that is what's nice, but you pay copays as you use the plan. It's more of a pay-as-you-go system. And you have to keep on paying that Part B premium. So to Medicare, that never goes away. It's kind of like death and taxes. So Part B premium doesn't go away unless you're eligible for like Medicaid or some other program that will eliminate that eliminate that cost. All right, so now let's talk about Part D, drugs. Part D drug coverage. So you can either get your drug coverage through a standalone Part D plan. That would be like paired with a Medigap supplement plan. Or you can get that with an Advantage plan that includes the drug coverage. So when it comes to drug coverage, Medicare has their drugs set up on different tiers. They're tiered 1 through 5. A formulary, that's just a fancy word for a list of covered drugs. So tier 1 and tier 2 drugs, those are your cheapest drugs. Those are your generics. So tier 3 drugs, that's where you're getting into like the brand name drugs and you're going to pay something for that. Tier 5 are your specialty drugs. So in general, the lower the tier, the cheaper the drug. And these plans, the drug plans, whether it's a standalone or with your Medicare Advantage plan, they also might have drug deductibles. Usually they're just for the higher tier drugs, but in some cases you have a drug deductible for all tiers. It just depends again on your plan. And I can help you evaluate that. I'll plug in your drugs, plug in your doctors, and it'll spit out which plan would be the least expensive for your prescriptions. All right, so when it comes to drug coverage, Medicare kind of has this odd system where they have different stages, and the amount you will pay for your drugs really depends on what stage you're in and how expensive your drugs are. So this chart that you're seeing, it shows 4 phases, but it's actually going to be reduced to 3 in 2025. So yay! We're actually going to be eliminating this 3rd phase called the donut hole. That's where most people's drugs go way up in cost. So they're getting rid of that, which is so great. It's excellent news. So the first phase is called the deductible phase. When you're in there, a deductible is just what you pay first before insurance kicks in. So that means you're paying the full retail cost of your drug when you're in that deductible phase. So not all plans have deductibles. Some of them do, some of them don't. It just kind of depends on what plan you pick and what's a good fit for your prescriptions. The second phase is the initial coverage phase. Now you stay in this phase until the total cost of your drugs reaches $5,030. Now that's not just what you pay. in this phase. So usually in the initial coverage phase, you're just paying co-pays or a percentage for your drugs. So that means, let's say you had a drug that was $100. That was the retail cost, and you only paid a little $10 copay. Well, remember, who's paying that other 90 bucks? That's the plan. So what you pay and the plan pays, when that reaches $5,030, which you kind of have to have some expensive drugs in order to do that, that's what kicks you into the donut hole or the coverage gap. When you're in that donut hole, and this is why it's kind of bad news, you're responsible for 25% of the cost of your drugs when you're in that donut hole. So you stay in there until the total cost reaches $8,000. And then that kicks you into catastrophic. When you're in catastrophic, you don't pay anything for your drugs. It's a zero cost for your drugs once you reach that catastrophic phase. But unfortunately, these 4 phases, they start over again every January. So the great thing is this next January for 2025, you will only see 3 phases, and you won't have to worry about that donut hole. So, wonderful news for everyone. All right, so now let's talk about Medicare supplement plans, also called Medigap. Again, 2 names. So it works with original Medicare. What it kind of looks like is when you go to the doctor, you show your original Medicare card, that red, white, and blue card that shows your A and B coverage. And then you also show your Medigap or your Medicare supplement plan. You bring that card too with you to the doctor. And that's what covers your costs. So it can't be used for Medicare Advantage costs. You cannot blend the 2 together. Remember, I told you that in the beginning where you saw the 2 pathways. You can't blend the 2. The great thing about supplements is they're standardized by the federal government. So what does that mean? That means that if you pick Plan G, because they're all lettered, if you pick Plan G, the medical coverage has to be identical from one Plan G to the next. The only difference are the rates, the monthly rate, and the annual rate increases. That's what makes a difference when it comes to the plans. So the most popular plan these days is Plan G. We'll talk about that in a minute, because that does give you the highest amount of coverage, but it also has the highest premium. So they're offered by private insurance companies. If you live in a different state, a few other states have a little bit different setup. So if you live in one of those states, you can just let me know and I'll help you with that. Okay, so here's the different letters. Yay. Okay, well, the most popular plan is that Plan G. And you can see why, because it has that 100% coverage. Now you'll see over on your far right, you'll see the Plan C and F. Those are plans that were actually retired for people. If you became eligible for Medicare after January 1st, 2020, you're no longer eligible for those plans. And really the only difference is, 1, those typically have higher premiums, and 2, Medicare said after January 1, 2020, they said, we're not going to have any plans cover that Part B annual deductible. So that's really the only difference. A lot of people, even if they're eligible for Plan F, still don't choose it because usually the premiums are higher because you have an older population that's eligible for it and they have higher claims. So, all right, back to Medigap. So some fast facts: you have to be enrolled in Medicare A and B, and you have to live in the state where the plan is offered. The great thing to know is that the first 6 months, I'm going to say this really slowly because this is a very important piece to remember, that the first 6 months that you're eligible for Medicare and you have that Part B, you get into these plans, a Medigap plan, Medicare supplement plan, with no questions asked. There's no medical underwriting. So if you have any health conditions, that's the time for you to get into a plan. But after that 6-month window is up, once that expires, you have to pass medical underwriting to get on a Medigap plan. They can be picky. They kind of operate kind of like life insurance, where they can either deny you and say, sorry, you're not healthy enough, we're not going to take you. Or they can put you at like a level 2 rate, which usually is like twice the typical premium. So, or you could get in at the standard premium if you're healthy and you don't have any issues or deniable drugs. So, but I would just say, just to stay safe, you know, if you want to go this route, I would always say get in when you first become eligible if you have any pre-existing conditions. So So that way you can't be denied later on. They have national coverage. There's no provider network because it just piggybacks on original Medicare. It's guaranteed renewable, which that means that just because you have a bunch of health issues or you have, a bunch of hospitalizations, a bunch of surgeries, they have to renew you. As long as you pay that monthly premium to your Medigap company, they can't kick you out. So that's nice. The plan premiums, they do vary from company to company, and the rate increases can increase they do increase as you age. So plans in general with more coverage have more premiums. You have to pay that Part B premium. So those are some important pieces to know. So when can you get on it? Like I said, when you turn 65, or if you delayed enrollment in Part B, once you get that Part B coverage, that's when that 6-month window opens up to you, when you don't have to pass any medical underwriting. You can apply at other times, just like I said, but they could deny you based on your health history, or charge you a higher premium. So some states might have other open enrollment rights, but here in Texas, and in most of the states that I work in, you only have just this 6-month window to get into a supplement without underwriting. All right, so first steps. The first steps you take is, just like I said, go to ssa.gov. If you need to enroll in Medicare, you get your Part A and B. And once you do step 1, that opens up step 2, where you choose these options. And that's where I come in. I'm the one where I can help guide you through what would be a good fit. I work with a lot of different companies because I'm a broker. And I'm a broker on purpose so that you don't have just one company or one plan to pick from, but you have a lot. And so you can do a Medicare Part D plan with a supplement. That's one route, like I told you before, or choose an Advantage plan, Part C plan, that combines the drugs with the A and B benefits all in one. All right, so a lot of people wonder, well, what's the difference? How do I pick? How do I know which one is a good fit? Well, so let's talk about Medigap first. So Medigap, like I said before, is an a la carte method. You're piecing together your coverage. You're going to have separate plans for separate benefits. So your Medigap plan, it helps pay for your original Medicare costs. So that aren't paid by can help pay that 20%. It can help pay those hospital copays and deductibles. It doesn't help with drugs, so that's why you have to have a separate Part D drug plan to go with it. Then it's national coverage. Any doctor that takes Medicare can take it. So if you're someone where you just want the freedom, you just want to go to any doctor that takes Medicare, well, this might be a good fit for you. Doesn't have any of those value added benefits. So dental, vision, and hearing are not included. So you do have to, again, get another separate plan with a separate premium if you want dental, vision, or hearing insurance. Medigap plans always have a monthly premium, and those premiums go up every single year. So, and the drug plans have premiums, and the dental, vision, hearing plans have premiums. So that's when you think about costs, just know it's going to be a little bit more expensive. It's considered more like prepaid medical. So whether you use it or not, you're still paying that premium, but it can be nice because at least your costs are predictable. And you kind of know, all right, this is going to go up every year, but I know that I'm not going to have any huge like co-pays to have to worry about. So some people like that predictability, especially if they've been on a health plan for most of their life where they didn't have to worry about co-pays. So that can be nice. So you can change your Part D plan every year to match your medications. So that's nice. Part D plans, they do have to take you no matter what. There's no medical underwriting with Part D standalone drug plans that pair with a Medigap plan. All right, so on the other side, Advantage plans. So Advantage plans, they have to cover all of the A benefits, the B benefits. Like I said before, sometimes people used to call Medicare replacement plans. They don't replace Medicare, but they're kind of like an all-in-one plan where they have the drugs typically included, and the dental, vision, and hearing can sometimes be included in those based on what you're looking for. They always have networks. So whether that's an HMO network or a PPO network, then that you can, if it's a PPO, you can go in or out of the network. And if you pick a national PPO, you can still have that national coverage. Some of them, they may have a plan premium. Most in our area don't, unless it has a plan with a lot of dental. So it's more of a pay as you go. You pay co-pays when you use the plan. So there's typically no additional premium for your drug coverage. So you pay those co-pays or co-insurance on the covered services. And remember, they have that maximum out of pocket, that cap to protect you. So even if you had a bad year with a lot of co-pays, you're still not going to go above that cap as long as it's a covered service under the plan. So those are kind of some differences between the two. And I sell them all, so it doesn't matter which one you pick. I like them both. When can you make changes? So Medicare has an annual open enrollment period from October 15th through December 7th every single year. This is when you can make changes. Now, remember, if you want to change your supplement plan and you're outside that 6-month window, you're still going to have to go through underwriting if you want to make changes to your supplement during this time. But this is when you'll want to make changes to your drug plan for your Part D. Unless you have a special enrollment period, this is your time in the year to make a change to a new drug plan that'll begin January 1st. So you choose your plan during this time, and then the start date is January 1st. So you can go from one Advantage plan to another Advantage plan every single year if you want, or you can just let it roll over every year. You don't have to make changes if you don't want to. As long as your plan doesn't get terminated, it just keeps rolling over. Okay, so the nice thing about Medicare Advantage plans is, let's say you make a change in the fall and then you realize, oh no, I made a mistake, or oh, my friend told me to get on this one and it's not as good of a plan as I was hoping. You can just give me a call and I'll help you get changed. You can make a one-time change during the spring, every spring, during Medicare Advantage's open enrollment period from January 1st through March 31st. It's only for people who are on Medicare Advantage plans already. So you have to be on an Advantage plan in order to make any changes. So you can go from an Advantage plan to another Advantage plan, just one change, or you can go from an Advantage plan back to original Medicare and get a standalone Part D plan. So that's for someone who might want to go on to a supplement at that time. So, but you can just make one change during this period. You can't make multiple, okay? All right, and then special enrollment period. Well, so this is based on like triggering events. The most common triggering event is when a person moves out of the area to a new area where new plans are offered. Also, another special enrollment period is if you're leaving employer coverage. You're ready to retire and you want to get off your employer plan and you want to finally get on one of these great Medicare plans. So whether that's a supplement with a drug plan or Advantage plan. So this is when you have a special enrollment period, and that's when you can enroll in those plans at that time. So let's say you are you want to know about some financial assistance programs. Well, there's a plan called Extra Help. What it does is the Extra Help program, you can get assistance with your Part D costs if you're eligible. This is based on your income and your assets. So if you want help with that, just give me a call and I'll tell you what the criteria is for that and how to apply. Medicaid also offers financial assistance. So again, that's also varies by state and it's based on your income and your assets. And there's also the Medicare Savings Program, which that can help pay for some of your Medicare Part A and B costs. And then there's programs of all-inclusive care for the elderly, also called PACE programs. You can also have these numbers to call the state health insurance office, we also call it SHIP for short. But if you have any questions about these, you can also give me a call as well. Here's my information and my number up on the screen. Again, Tia Pruett. So I'd love to help you